From WREL News and the Capital Broadcasting Podcast Network, this is your Coronavirus North Carolina News Brief for Wednesday, June 24th, 2020. I'm Cliff Baumgardner. Here's the latest from WREL.com. Today, Governor Roy Cooper said coronavirus metrics in North Carolina are not sufficient for the state to move into the next phase of reopening, and announced a new requirement for everyone to wear face coverings in public. Citing metrics that continue to rise instead of leveling off or decreasing, Cooper extended Phase 2 of his three-part pandemic response plan for at least 3 more weeks. The executive order that moved the state into Phase 2 last month had been set to expire this Friday. He also issued a statewide mandate that people cover their faces in public, indoors or outdoors, when physical distancing of 6 feet or more is not possible. Masks will be required of employees and customers of retail stores and restaurants, as well as workers in manufacturing, meat processing, and agriculture. Exceptions will be made for children under 11 years of age, as well as people who are exercising outside, and those with medical conditions. Governor Cooper said health data shows face coverings are effective at preventing the spread of the virus.
Overwhelming evidence that is growing by the week shows that wearing a face covering can greatly reduce the spread of COVID-19, especially from people who have it and don't know it yet. Required face coverings not only cause zero harm to our economy, they in fact help our economy by making it safer to shop, do business, and keep our small businesses running.
Coronavirus hospitalizations and caseloads have hit new highs in over a half-dozen states as signs of the virus's resurgence mounted, with newly confirmed infections nationwide back near their peak level of 2 months ago. After trending downward for 6 weeks, the U.S. caseload has been growing again for over a week, particularly in the South and West. Some 34,700 new cases were reported nationwide yesterday, according to a count kept by Johns Hopkins University. In North Carolina, hospitalizations due to the virus topped 900 for the first time yesterday, continuing a trend in recent weeks. Since the first case was detected in early March, more than 56,000 people have tested positive for coronavirus in North Carolina. The state recorded its second highest one-day total of new virus infections today at 1,721. Because state guidance has limited the number of people tested to those with symptoms, those in high-risk positions like medical or correctional facilities, those with a known exposure, and more recently those who have been in a crowd, the true spread of the virus is impossible to measure. Many people who contract the virus show no symptoms. Others suffer what feels like a bad case of the flu. But as of recording, the virus has been fatal for at least 1,294 North Carolinians. Earlier this week, Dr. Anthony Fauci told a congressional committee he was cautiously optimistic a COVID-19 vaccine could be available by the end of the year. But researchers from Duke University who are working on such a vaccine say that timeline isn't realistic. The consensus among the Duke experts WREL News spoke with was this: while it's possible some people will be able to get a vaccine this year, it will not be widely available. One Duke researcher in Singapore, who's working on a vaccine, said they are in the animal testing phase right now but hope to move to clinical trials soon. The researchers explained that it will take a while to learn if the vaccine is effective. Then there are practical considerations. Manufacturing millions or billions of vaccines will take a lot of time. One researcher said that while it's possible a vaccine could be approved this year, scaling to meet the needs of the global pandemic will take longer. Duke researchers said they think this time next year is a more practical goal for when a vaccine might be widely available to the public. And lastly, more than 1 million people in North Carolina have filed for unemployment benefits since the pandemic began, making it a very challenging time to find a new job. But a free program called NC Works is helping people find new opportunities. NC Works has 94 career centers across North Carolina. Although many of them are closed because of the pandemic, they can be reached by phone. Job seekers can also access a database of available jobs and chat with career counselors on the NC Works website. NC Works also has experts available to provide necessary training or to help update resumes. Brenda Wilkerson, a spokeswoman for Capital Area Workforce Development, said while many industries have shut down during the pandemic, workers may have skills that are applicable in other fields. She says the main goal of NC Works is to, quote, build a strong workforce in our area so that our businesses have the talent that they need. If that requires transitioning people from one industry to another or one occupation to another, then that's what we want to do. During the last program year, NC Works was able to help more than 30,000 people find new jobs. Half of those were helped directly by NC Works staff, while the remainder used the resources available online to build resumes, search for jobs, and take advantage of available workshops. More information can be found at ncworks.gov. This has been your Coronavirus North Carolina News Brief for Thursday, June 24th, 2020. As always, if you like the information and resources you get from this show, let us know. Leave a rating and review wherever it is you listen. And while you're there, don't forget to subscribe so you don't miss our new episodes. Thanks for listening.